All right, good morning, everybody. This is April 15th. This is Anchorage Emergency Operations Center update.
Yes, good morning. This is Adrian Duby, Documentation Manager. In Alaska, we see an increase of cases of 715, one additional death, and 19 additional hospitalizations, and bringing down to Anchorage. In cases, we see an additional 264 with that additional death and additional hospitalizations of 7. Next slide. In our 213 resource requests, we have filled or satisfied 1,730, and currently we have open and working 17. Next slide. In the non-critical transport, we have seen 31 in the last 24 hours, with 2 of them after hours. Under sheltering in our congregational sites, we have 416 clients, non-congregate sites 311 clients, giving us a total of 727 clients with 2,181 meals a day. Next slide. In our testing, we have collected 849 samples, and that's a rate of 78 per hour. And in vaccines, we have at the Dempsey a total of doses to date of 4,630. At Blood Bank of Alaska, 8,436. At Shiloh, 1,874. Diamond, 1,454. And the VH Mobile shows 971 doses to date. End of report.
So currently, right now, the temperature at the National Weather Service office in Anchorage, Alaska is 40 degrees. We're expecting a high of 44 today for the Anchorage Bowl, a low of 30, 20% chance of rain showers. On the radar, we can see some isolated showers over the Cook Inlet and Turnagain Arm. It's not very organized, but there's just a few weak disturbances that are overhead, so it's a possibility for light rain showers. And then the next, I wish you could have seen this slide because you'd love it. Friday through Monday, the temperatures are increasing from 47 to 54. We are in a warming and a drying trend, so it's going to feel a lot more like spring.
Thank you, weather.
You're welcome.
Operations.
Hey, good morning. The spring is here on many levels. Hey, this is Pat Ryder, Deputy Operations Section Chief. This morning with our mass care branch, our Q&I location has 11 projected discharges through Sunday. That's to include no discharges today. Our warming tent had 55 people over the past 24-hour period. For public health, visit healthcare testing had a decrease of 5.09% over previous Wednesday's sample collection. We have a 7-day rolling positivity rate average of 2.82%. That's a decrease. A 14-day average reproductive rate of 1.048. Our 14-day average case rate is 22.14 per every 100,000 people in the population. With pop-up testing, we had testing starting April 12th at 800 K Street from 8 in the morning to 7 p.m. in the evening. This location will operate all the way through Friday. April 17th, we have Muldoon Elementary School operating from 8 in the morning to 7 p.m. With medical countermeasures, most people know by now our J&J recall. All clinics and appointments are being canceled, and we are working to offer alternative vaccines. With Visit Healthcare, our Northway Mall use agreement is coming along. It's already been signed by Visit. We are still waiting for the signatures from the Northway Mall. Our Diamond Center J&J days are going to pivot to both Moderna and or Pfizer. And also our mobile teams will be offering Pfizer going forward. So barring any questions, this concludes operations. I'll hand it off to logistics.
Good morning, all. This is Scott Carpenter, the Logistics Section Chief in the EOC. Although you'll see a slide that's not quite as busy as operations, there's a lot of work going into everything you see on this slide, and these are just kind of broad brush actions that we're taking care of. Under the medical countermeasures, we continue to work the vaccination sites. You see that the Northway Mall is in work and should be working in short order. Mass care support, we continue to work the summer support requirements and contract modifications as necessary. And as far as the EOC is concerned, we continue to work on transition planning, event planning, and staffing requests. So our little pictures here, as you can see, we have a lot of irons in the fire, but I wanted to take a minute to just publicly thank some of our external MOA partners who make all of this happen. You know, the logs folks and the EOC are essentially running the show on the request, but a public shout out to both the purchasing office and the folks over there, Franz, Nikki, and David, as well as the HR department, Ron K, for all the terrific work they do to support the logistics. That concludes my briefing, pending any questions.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief. Today, the EOC has encumbered $19,202,006. Our actual spent to date is $46,361,740 for a total of $65,563,746. Please continue submitting your invoices and supporting documentation to the EOC through the email address eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery for expenses by way of FEMA public assistance. If you have an interest in that, please contact aaron.zachary@anchorageak.gov. End report.
Thank you, Carrie. Safety.
Good morning, everyone. This is Safety Officer Aaron Carter, filling in for Annalisa Roberts. I'm happy to relay that no safety incidents or near misses have occurred since our last meeting. Briefly, I'd like to mention that April is Stress Awareness Month, and if you look at any type of stress management lists, there's always the big three: exercise, diet, and sleep. The CDC and OSHA recommend that you get 30 minutes of exercise per day, 5 days a week. You eat a healthy and balanced diet, 3 meals a day, and sleep 7 to 8 hours per night. These are the stress management cornerstones for having reduced stress. That concludes my brief. Thank you very much.
Thank you, Aaron. Public information.
Hey, good morning, everybody. Cal Casey here, reporting out for the information officers. We're reviewing social media materials from the COVID-19 Community Corps for use on our social channels. We've shared and are sharing public library messaging and videos edited by Andy Lyon over HD that are focused on overcoming hesitancy. We're fielding several media requests for the Sullivan Arena transition question and timing, and PIO Rono's handling those. We're monitoring the status of the J&J pause while taking the national best practice of encouraging uptake of the 2 vaccines that we do have. Developing messaging and educational materials for the summer camp directors. We're coordinating with the HD PIOs and Mass Care on the proposed vaccine week, and we should have more details after a meeting today. We're identifying community partners who can contribute time and prizes to Vaccination Week festivities to increase participation and outreach. We're working with Mautosi and Northway on our May 1st kickoff, Breaking the Ice community dance competition, creating flyers, incentives for vaccination, and an info booth. Reviewing the MOA website for any needed edits or updates to ensure it's totally accurate, and still sending out the outreach email to key influencers and leaders. Just for a side note, PIO RUP is on days off for the next few days. End report for PIOs.
Thank you, Cal. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all of our partners who were able to join us today. Alaska Native Medical Center sent in their report, and they have 4 positive, 0 in the ICU, 0 on the ventilator, and 0 persons under investigation. Is Sean on for Alaska Regional Hospital?
Alaska Regional Hospital has 7 COVID patients, 5 who are actively isolated, 1 in the ICU, 3 PUI.
And is Michael on for Providence Alaska Medical Center?
Good morning. We have 12 COVID positive patients, 7 of whom are in the ICU, 2 on mechanical ventilation, and 6 COVID recovered inpatients.
All right. Thank you very much, Michael. And do we have anyone on for the 673rd Medical Group?
Good morning. This is Sergeant Perez with the 673rd Medical Group. Although I'm not able to report out on our current COVID cases, I will report out that we have received a total of 12,250 vaccines, and we have administered a total of 11,300 of those. Pending any questions and a report.
Great. Thank you so much. That's really valuable information. And Matsu Regional was not able to join us today, but they were really happy to report a significant drop in numbers. It's actually half of what it was on Monday. So we have 6 positive cases, 3 in the ICU, 2 on ventilators, and no PUIs. And that's all for liaison. Thank you.
Thanks, Celeste. And Commander Loach.
Hey, good morning, everybody out there. We have had a busy week this week. Hopefully, on the weekend coming up with that warmer weather, we'll try for some more exercise, diet, and sleep as prescribed by our safety officer, trying to keep our stress managed. Thanks, safety. We are highlighting today our extension of our emergency declaration locally, which was approved by the Assembly this week through June the 11th. We also had an EOC policy group meeting this week, and we talked about new reporting requirements that are coming out. I just wanted to make sure everyone that everyone knows that we do have a daily situation report that's available on the web. Tons of information for your analysis and feedback on our dashboards as well. And then the Anchorage Health Department does put out a weekly document with analysis on health metrics and just making sure that everybody's aware that that information is out there. But with new reporting requirements from our different partners and entities, we will be updating some of those documents in the near future. As well, I just wanted to note on outreach. I know that we have Vaccine Week coming up in May, but we do have a lot going on in the vaccine department, and our public information team is working as hard as they can to make sure that that information's getting out to all different areas of the community. I'd urge, if you have ideas for outreach or ways that we can maybe improve that, to let us know. But thank you for all the outreach that we've been doing on vaccines. Even though Vaccine Week is coming up, we have a lot of vaccine available right now in the community, and anything we can do to get those shots in arms is helpful. Just a reminder as well to continue wearing masks, wash your hands, and social distance, and staying home when you're sick. Thank you for all the continued work and moving forward and finishing strong. Thanks, everybody. End report.
Thanks, Amanda. Moving on to questions. We did have one in the chat. Appreciate all the hard work on the Northway Mall launch. Excited to share with friends. Is it safe to say it will be this weekend on Saturday? And MCM says we'll know more this afternoon, and we'll keep everybody updated. So thanks, Dana, for answering that in the chat. Were there any other questions this morning? Our next meeting will be the 19th of April at 10 a.m. Everybody have a great rest of your day. Enjoy the sunshine and have a great weekend. Thanks, everybody.